A typical patient with claudication will complain of pain or discomfort, usually in the muscle. It hurts them typically when they're walking a certain distance. When they walk that certain distance at a certain pace, it typically will reproducibly cause that pain, which often causes them to stop. When they stop, it takes several minutes typically for the pain symptoms to go away, and then they can resume walking. In a patient with typical claudication, they'll walk that same distance again, that pain symptom will come back again, and they'll have to stop walking. The reason the pain comes is because the patients are having a lack of blood flow to that affected limb or to that muscle. As you're exercising, right, you need more oxygen to go to that particular muscle. If there's a narrowing of the blood vessel, you can't deliver enough oxygen. Ischemia or lack of blood flow problems begin to develop, and the nerves begin to sense the pain. You can see PAD is more common than very common diagnoses that you think of, like cancer, stroke, and Alzheimer's disease, with about a 12% of patients with PAD. Obviously, coronary artery disease and diabetes are slightly more common, but you see PAD is a very common diagnosis. Who gets PAD? What are the risk factors for developing PAD? If you leave here remembering two things, it's smoking and diabetes are the two most common factors that drive the vast majority of patients that have peripheral arterial disease involving the legs. Two things that happen with patients with PAD that we really want to bear in mind. One is that it can cause symptoms. So obviously it can cause pain in the legs, and I'll talk a little bit more about the symptoms in a little bit. But when people begin to have pain in the legs, they can become more sedentary, right? Less exercise, decreased quality of life. That can obviously lead to depression. In the worst case situation, it can actually lead to an amputation, which obviously has a very significant negative impact on patients' quality of life. Those are symptoms related directly to the blockage in the leg. That being said, I think maybe as important, if not more important, are what's going on with the heart and other vasculature. And obviously, I'm a little bit biased because I come from a cardiology background. It's very important to point this out because patients that have leg blockages have a higher risk of chest pain, angina there, 2 to 3 times higher than the average population, a 2 to 3% annual incidence of a heart attack, and it's unfortunately the most common cause of death, being cardiac. About 40 to 60% of patients with PAD actually die from a heart-related issue. Now, we've talked about the questions that physicians should be asking. What test should they send you to? What they actually use is ABI. Let's talk about what that means, because this is the sort of initial sort of screening test once we have some suspicion that somebody might have PAD. And it's a really simple test. It can be done in the office. We do them. It can be done in the office just with a blood pressure cuff and a little Doppler machine, or it can be done in a more sophisticated fashion. Either way it's done, it's a great screening test. Basically what you do is you measure the pressures in both the arms, so both the upper extremities, and down at the ankle on both legs. And then you basically compare what's the pressure in the ankle relative to the pressure in the arm. Any patient that has normal pressures, no blockages, should have pretty equal pressures in their arms compared to their legs. Does that make sense? So patients that have blockages in their leg arteries, it's like your hose. You turn the hose on, it's coming out full bore, all of a sudden nothing's coming out. What's happened? You got a kink or some narrowing in the hose, right? And that causes the pressure to fall. So if people have lower pressures in their legs, that's a strong indicator that they likely have blockages in their leg arteries. So simple pressure done in the office, both arm pressures, both leg pressures, and then we just compare them as a ratio. And we use these ratios to help us decide what the severity of the disease is.